Do you want this?
Do I want it? No.
I mean, I'll hold on to it and change answers as I look through the book.
Sounds like something Beach would do, not you. Expect more than that out of you.
I learned from the best.
Wouldn't I ever do anything?
All right, here we go. We're going to talk about airway today and airway management. And so along with talking about airway management comes a couple of skills that we need to practice that are necessary in order to make sure that you have a patent airway in your patient. The most important thing that you need to know is that patient assessment cannot be overemphasized. We are going to spend hours and hours and hours talking about patient assessment. But patient assessment is a skill that you must master and you must practice it continually, or you'll forget things. And if you forget things, you're likely to not take as good of care of your patient as you need to. Okay, so we can't undervalue patient assessment. We need to remember that it's super important. Patient assessment, in some degree, is used in every single patient encounter. So, today, we are talking about airway, and it would be really, really super nice if I had my airway notes out instead of my patient assessment notes out, right? Okay, so I've now corrected that one problem. When we discussed the anatomy and physiology of the airway, we didn't spend as much time on airway as we need to, but we spent a little bit of time on it, right? So today we're going to spend a little bit more time on it, and we're going to split the airway into two parts. We're going to split it into the upper airway, and we're going to split it into the lower airway, okay? We did that a little bit already, right? So what are the structures in the upper airway? The mouth? Tongue?
Nasal air passage, the nose.
Okay, your nares or your nasal air passages. What else?
Oropharyngeal.
Your oropharynx.
Nasopharynx.
Your nasopharynx.
Pharynx.
Pardon?
Just the regular pharynx.
Just your regular pharynx.
Yeah.
Trachea.
What else?
Trachea.
Your trachea.
Is that the lower?
Should go into your larynx.
Like
And then below the cartilage there, your cricoid and your thyroid cartilage, below that becomes your trachea. And that division, that cartilage there, is a division between your upper airway and your lower airway. Thyroid and cricoid cartilage, yes. Okay.
Epiglottis.
Yep, we have an epiglottis. That's kind of important.
So trachea is lower than.
Yes.
Okay. It's below that cutoff point.
So what were the two names of the cartilage that we have here in our airway?
Cricoid.
Cricoid and
Tricoid.
Something like that.
cricoid cartilage and thyroid. It's the thyroid cartilage. What's the name of the bone that's in that same place?
Cricoid, tricoid, cartilage or something like that? Cricothyroid cartilage, isn't it?
Okay, the name of the bone is the hyoid bone. Okay, so the cricoid cartilage,
That's the one that's floating, right?
that's the one that's floating, yep. The thyroid cartilage, the hyoid bone, okay, and that membrane that we have in between our cricoid and our thyroid cartilage is called the cricothyroid membrane, right? We learned that when we were doing our review last week. Okay. Are there any other structures in our upper airway that we need to know about?
Your uvula.
Okay, your uvula belongs there. Why is the uvula important?
Because it's there.
Because it's there. Why is it there?
As a gag reflex.
It stimulates your gag reflex. And why do we care about the gag reflex when we're talking about the airway?
Because if you are trying to insert something in there, and the gag reflex is there still, then it could possibly cause more issues.
It could cause more issues. What kind of issues is it going to cause?
Like vomit might go and block the airway and get into the whatever it's called, yeah.
Okay, so if we trigger a patient's gag reflex, we could cause them to vomit. If we cause our patient to vomit, there are a couple of different not great things that could happen from that. Okay, one, they're going to puke on us. That's not fun, right? Two, they could puke and then inhale it. If a patient pukes and inhales that vomit, what is that called?
Aspiration.
Aspiration. And what happens, or what could happen if a patient aspirates vomit? They could choke.
Yeah, they could die.
They could die. We could give them pneumonia, aspiration pneumonia. Okay. So we don't really want to ignore the important parts of our system, like the uvula. All right. Anything else in the upper airway? That we need to know about?
Vocal cords.
Your vocal cords. Where are your vocal cords located? Anyone?
Right by the cartilage.
Yeah, they're right by the cartilage. So they're actually in the middle of that cartilage, and if you were to look into a patient's larynx, it looks like there's almost a triangle that looks kind of like this, and on the outside of that triangle is a couple of white, pale, let's call them pale rather than white. There's pale lines right here. So when you look into a trachea, you see something that's kind of like this. Now remember, it's going to be pink because, you know, your skin tone inside is going to be colored by your blood. So we're going to see something like this, and then you're going to see this opening right here. And this opening on the edges right here is it's paler. In our mannequins, it looks white, and maybe if we have time tonight when we're doing our other skills, maybe we'll spend some time with the laryngoscope so you can see what a trachea or what a larynx looks like. Actually, Beach, in there, in that closet right there, if you walk to the back of the closet and look at the top of the spinal immobilization shelf, you will see 4 boxes that have airway mannequins in them.
Yep.
Can you get 2 of them down, and will you make sure that one of them has a small model of the mouth inside of it?
Yeah, I do.
I asked you because you're the tallest.
I figured.
Okay, so he's going to get the airway mannequins down, and a couple of them have a small model of the airway in it, and I'll pull it out and I'll show you the larynx and the vocal cords in there. And then if we have time, we can play with the larger mannequin and see if we can see what we should see. Why don't you press pause for a minute? I hate to make whoever's watching